why are so many people on weight loss injections losing their taste for alcohol? And for a while, it was just stories and anecdotes, but now there have been 2 recent studies that have moved it from personal stories to real data. And the drug is semaglutide, which is the same thing as Ozempic and Wegovy. And there was a Lancet trial that was published a few months ago where researchers put 108 people with alcohol use disorder and obesity on either the weekly injection or placebo, and both groups got cognitive behavioral therapy. In over 6 months, the semaglutide group cut their heavy drinking days far more than the placebo, with an effect as strong as the addiction drugs that we already have. And then just a few days ago, there was another trial that looked at the pill version of semaglutide that was sold as Rybelsus, and in 50 people with alcohol use disorder, it cut their heavy drinking and how much they drank per sitting, and it also cut their real-world cravings and even their cannabis use. So why would a diabetes and a weight loss drug affect drinking at all? Well, these GLP-1 medications, they don't just act on your gut, they also reach the brain's reward system, the dopamine circuits that make food and alcohol feel good. And that actually extrapolates to something bigger. For most people, having obesity was never a willpower problem. Their biology is just wired differently, with stronger cravings and more hunger hormones and less fullness and a bigger dopamine hit from food. And a lot of it is very similar to what drives addiction. So it's not surprising that a drug that turns that reward signal down doesn't just quiet hunger and food noise, it also eases alcohol cravings. And all of this lines up with what I've been hearing from my patients for many years now. It's not just drinking. I've had patients that told me they don't gamble anymore. And I had some patients that told me they don't shop as much and that retail therapy just kind of lost its grip. So different habits, but the same reward circuit. And alcohol addiction is also one of the most undertreated problems in medicine. We haven't had a new drug approved for it probably in 2 decades, and the 3 that we have are hardly ever used. So a drug that works on this would help a lot of people. But it's early though. The Lancet trial only included people who also had obesity, so drinking problems alone aren't settled. And the pill trial was small and short, and it actually missed its main cravings target even as the drinking fell. And none of this is approved for addiction yet. It's all off-label, but there are bigger trials, including a large one in US veterans that is currently underway.